Fox News medical correspondent Dr. Marc Siegel is here. Marc, you know, the big concern now is the bacteria in the water. We'll talk about the animals in a minute, but the bacteria, what do you think could be in there, and what is the health risk of those types of bacteria?
I mean, the water is contaminated because that water, even when it touches anything else, you know, whether it's an animal, whether it's a sink, whether it's a toilet, bacteria can be introduced. And then if people drink it, or if they even bathe in it, or if they touch it, or if it's in their homes and it touches fabrics or things like that, they try to clean it. Even if you try to disinfect it, you're not going to get rid of it except on hard surfaces. So we have the risk of drowning that Griff mentioned. We have the risk, by the way, of people banging into things with water and not realizing it, getting injured, getting cuts that get infected. Did you have a tetanus shot over the past 10 years? There's tetanus in those waters. There's E. coli. There's salmonella. So there's all kinds of risks of bacteria. A virus called hepatitis A is in there. And again, risks of injury.
What about, so first off, so we talk about the bacteria, but then also, what about the drinking water? I mean, do they have safe drinking water? I know that some of the bigger companies like Anheuser-Busch have been sending down cases and cases of canned water, but how much contamination is in the water as far as drinking goes?
You know, that's a really important question, Cheryl, because there's a lot of contamination, because a lot of people in that area use wells. And wells can be contaminated by flood water, and people may not realize it. Go ahead and drink it, get sick with bacteria. The key is, if you're not sure whether your water is pure or not, you have to boil it before you drink it. That's really important. And of course, if you're getting diarrhea, then you get even more need for clean water. And if you have an underlying medical problem, you have even more need for clean water. And so one of the things that has been talked about, I spoke to HHS Secretary Price the other day about this, is, you know, chronically ill people, you have to make sure they have their water, they have their electricity, they have their medications.
I know.
This is really important.
Oh, it's crucial. Dr. Siegel, thank you so much. And I just want to let our viewers know what you're looking at is live pictures out of Wharton, Texas, from correspondent Matt Finn's camera. We've been watching animal rescues here, actually in the commercial breaks, for the last half hour or so. These poor animals, they look exhausted and tired, but they are safe. You've got the Humane Society of Houston, the National Humane Society, the ASPCA. They are all on the ground. They're volunteers from all over the country, I got to say, are down there in Texas trying to rescue those animals. People fled for their lives, and a lot of them had to leave their pets behind. You've got amazing, amazing volunteers like these that you're seeing on your screen going out there and getting these animals. That poor baby looks exhausted.